Welcome to the EarlySense tutorial video. This video will demonstrate how to utilize the bed exit functionality for fall risk patients. For any elaboration on how to operate the EarlySense system, please refer to the relevant user guide provided upon installation or online at earlysense.com. The sensor can detect movement in bed or chair. When a patient is moving away from the sensor, it might indicate a bed or chair exit attempt. Reminder: you will need to unlock the CDS by hitting the lock in the top left-hand corner. Click on the patient's room and bed number on the CDS to access their profile. You can set the system to alert you if a patient is attempting to leave his bed or chair, or if a patient has exited his bed or chair and didn't return after a certain time has gone by. There are 6 sensitivities for bed exit alerts, 6 being the most sensitive and 1 being the least sensitive. This means that higher fall risk patients should be on a higher number sensitivity. Sensitivities 3 through 5 are referred to as posturing sensitivities, meaning the system would alert for a bed exit if the patient's back came forward off the sensor or if they were sitting on the edge of the bed or chair. To change the sensitivity, simply press on the value of your chosen sensitivity under the patient's profile at the CDS. Adjust the sensitivity to the condition of your patient by observing his or her behavior. It is always recommended to start with a higher sensitivity and to reduce it if needed after consulting with the unit's manager. Please note that an alert can only be acknowledged by a staff member at the bedside. A patient returning to bed or staff muting the alert at the CDS will not dismiss it. For more information on the use of the EarlySense system, please visit www.earlysense.com.